Extreme levels of uric acid reduce patient survival. Research finds. A new study by researchers at the University of Limerick School of Medicine, or UL, found that extreme values of serum uric acid, or SUA levels in the blood, can decrease a patient's chance of surviving. Extreme levels of uric acid were also found to decrease their lifespan by up to 11 years. It is the first of its kind in Ireland and of the largest research studies. The study was seed-funded by the Health Research Board, or HRB, and published in the European Journal of Internal Medicine. The researchers used data from the National Kidney Disease Surveillance System, or NKDSS, at UL. They then created a large cohort of 26,525 patients. These patients entered the Irish health system at University Hospital Limerick between January 1, 2006 and December 31, 2012. The authors followed the patients until December 31, 2013. Dr. Leonard Brown, PhD, is the lead author and senior research fellow in biostatistics at the UL School of Medicine. The median survival for men with low levels of SUA, or less than 238 micromole per liter, was reduced by an average of 9.5 years. For men with elevated SUA levels, or greater than 535 micromole per liter, it was 11.7 years. For women, the median survival dropped to almost 6 years with SUA levels higher than 416 micromole per liter, unlike those with SUA in the normal range. The shape of the mortality curves was different for men and women, said Dr. Brown. For men, the shape was predominantly U-shaped with optimal survival between 304 to 454 micromole per liter. For women, the pattern was J-shaped with elevated risk of mortality only present for those with SUA levels greater than 409 micromole per liter. Professor Austin Stack is the study's senior author and foundation chair of medicine at UL School of Medicine. Stack said there was strong evidence that high SUA levels are correlated with a variety of serious chronic medical conditions like heart disease, stroke, diabetes, hypertension, and kidney failure. These known links might in part explain the high mortality that the researchers observed with patients with elevated SUA levels. In fact, they found that men and women with very high SUA levels died from cardiovascular causes, noted Stack. Surprisingly, very low SUA levels were also correlated with a higher risk of death, primarily in men. The present study further supports the existing evidence of SUA as a major predictor of survival and a potential target for treatment.